Generally with seniors, we're more cautious with because for one, their bones are generally more frail and more prone to having fractures. So that's something that we'll rule out in the initial assessment to make sure that they don't have osteoporosis or past falls or can have fractures that have been in the past. So generally, it's a very safe profession in that we do our due diligence to make sure that when to adjust and when not to adjust. But overall, the safety of what we do as a chiropractor to manipulate these bones and joints is very safe. And if you use the proper technique to address the proper injury or the proper problem, the risks are very minimal. And a lot of patients report a lot of relief naturally through chiropractic treatment. So that's something that, in terms of worrying about getting hurt, yeah, there's always a risk. But if you do a proper care and proper questioning and proper examination, you can rule all those out and do the proper treatments accordingly. It all varies according to the type of case that we deal with, depending on the patient's condition as well as their age and what kind of past problems that they had. So we determine whether it's safe or not. But generally, we want to make sure that we do no harm. Our goal is to help and to prevent problems and obviously to reduce the pain that the patients are coming in for. In general, what we recommend is once a month in terms of maintenance. Now that all varies too, as accordingly to the patient's condition. Some people require more than that. Some people require once a week. Some require every 2 weeks. So depending on your seriousness of your condition, that would vary accordingly to what kind of problems you have, how long you've had it for, and how much pain or problems you're dealing with. And I see patients that get regular adjustments. Usually once a month is the general standard, but there's some elderly patients that I treat that I see regularly once a week. And the weekly adjustments has helped him prevented him from any problems or any pain, as well as reduce any of the medications that he has to take. So it has helped him a lot in terms of keeping his health optimal with minimal medications and minimal pain. Yeah, I mean, each condition requires certain nutrients for the body to have in order to restore that healing and restore that balance. Generally, in a lot of pain cases, we see a lot of inflammation. So generally, you want to eat foods that prevent inflammation production or reducing of the inflammation process. For example, pineapples is a very good anti-inflammatory. And also foods that create inflammation, such as red meats, the beef, the lamb, the goats. Those are kind of food that you want to avoid when you have inflammatory process that goes on. So you want to avoid those kind of foods. There are many other foods that addresses certain conditions in the patient, but pain and inflammation is the key to what we see a lot of. Also, for the elderly, they're worried about bones fractures and osteoporosis. So there's foods that can help increase the bone density into their bones so that they have stronger bones to prevent these fractures in the future. Pros and cons to the juicing and to eating the whole foods. When you're juicing, you're getting the whole nutrients without the fibers, the fiber from the actual fruit itself. Also, at the same time, when you're juicing, your concentration of those vitamins are massive compared to eating, let's say, an apple, where you can juice, you can put 10 apples into a glass. So you don't normally eat 10 apples a day. So the amount of juicing compared to the amount of fruits, the whole fruits you eat, is very important in terms of how much volume you're taking. Sometimes you can overdose into these juicing into your body, and your body will let you know. And the most common side effect to overjuicing is diarrhea, which is having too much vitamin C from these fruits or sometimes vegetables that you get into your body, and your body has a way of restoring that balance. So the key is to keep it in balance. Whether there's an advantage to juicing or eating the whole fruit, I think there's pros and cons in both. But I think that the key thing that you should try to do is the to have that right amount of volume, and I just make sure that you don't overdose on it. With regards to pain and suffering in the elderly, the most painful incidents that I deal with mainly involves nerves. Patients that have sciatica, for example, which is a nerve that goes from your lower back down to your legs and to your toes and your feet. When that nerve gets inflamed, it creates a shooting, sharp pain, like a stabbing pain, and every movement creates a stabbing sensation, like somebody stabbing you in the back or in the leg, and that prohibits the mobility, the movement, and the happiness and the quality of life in the patient. So, in terms of the most painful, that is probably nerve pain. What I would suggest is probably the most difficult to treat and the most difficult to watch the patient go through, because you feel their pain just looking at them, and every breath seems to have pain associated with it. Let alone just trying to move, go to the washroom. So it does affect the quality of life, and just the severity of the intensity of the pain is quite severe. That is probably the one thing that I do not like to see, is a patient suffering in that intensity. When you try to do everything you can to get rid of that pain, and sometimes it's not easy, and a lot of times it does last some time before that pain alleviates through our treatments.